do we talk about single payer? One of my mentors was Dr. Quentin Young, and he always reminded us that we need to focus on the elegant simplicity of single payer. And if you look at the cartoon there, you see, all of this hodgepodge on the left-hand side, and then just this single payer. It's simple. It's one system. Everybody's in it. So when I'm trying to explain to people what I mean by a single payer system, National Improved Medicare for All, I just kind of break it down and say it's a national system. Every person living in the U.S. and every health professional is in it. Wherever a person goes around the country or, or in our territories, they're going to be in that system. And it's from prenatal care through death. It's improved in that the care is comprehensive, or the coverage is comprehensive. It includes all medically necessary care. And we advocate for long-term care and no copays or deductibles. And like Medicare, it's financed up front through a progressive tax, so each person pays according to their means, not their health status. All right, let's go to the next slide. And there's just a couple more. Now is the time. As I've said it already, we're spending twice as much on healthcare per person, and still leaving tens of millions of people out or underinsured. We're wasting hundreds of billions of dollars every year in excess costs and overpayment to pharmaceuticals. So that's $500 billion estimate for administrative costs and about $100 billion overpayment for pharmaceuticals. This is more than enough to offset the cost of coverage, comprehensive coverage for everyone. Why should we keep paying for more and sacrificing people's lives to ensure profits for health insurance? And for those who believe that we should have something less than universal coverage, we ask who should be sacrificed, who should be left out. Next slide. So I think this, okay, just two more slides, I think. There is no backdoor to National Improved Medicare for All. Remind yourselves that when people say that we can just do this other easier thing and it will get us there. We have to be prepared to face opposition because we're on the right side of history. Social movements are always told they're asking for too much, but we have the power to change the political culture so that the impossible becomes inevitable. We need to educate people about this, do outreach, mobilize people, and escalate our pressure over time to win. And part of the reason that I moved from advocating just for single payer into a broad range of issues is that all of these issues are connected. Healthcare is connected to everything that we do. It's connected to the food we eat, the water we drink, the air we breathe, the jobs we have, how much education, if we have a home, if we're safe in our communities from violence. All of these things impact our health. And so all of these can unite us in fighting for a healthcare system that serves our needs. Let's go to the next slide. So just finally, for Green Party, members, I think that this is one of the many issues, but this is a very important one right now. That's, it's one of the top issues that people are concerned about that really differentiates us from the other parties. We are the only political party other than the Socialist Party that has single-payer health care in its platform. So I think it's really important for us to use this as an issue that differentiates us from the other parties, and also is important that we get out there and start leading the way on this. Right now, Democratic Socialists of America are very active on this issue, a lot of social media on it, and I feel like this is an issue that we as Greens should really be owning. So what can you do? We have a campaign called Health Over Profit for Everyone. It's healthoverprofit.org, and this is made up of some of the strongest single-payer advocates that I know around the country who wanted to have a campaign where we could actually have the flexibility to do what is necessary to fight for this system. So many of the groups, like just typical groups that are involved in advocating for this have certain restrictions of what they can do, and we wanted a group that didn't have those restrictions. So that's HOPE, Health Over Profit for Everyone. We do national calls on Monday nights at 9 o'clock, and you can sign up for those if you're interested in learning more. It's bit.ly/HOPE calls. We have a lot of tools pages that will help you to organize educational events in your communities. There's a lot of movies that you can show to to educate about this and do discussions afterwards. There are, single payer advocacy groups in most states, so there are often speakers that you can invite to an event. We have a Tools for Education page that has all kinds of charts and one-pagers and things that you can use to hand out. We need to be organizing actions as well as attending actions. And this photo on the right is actually a march that we did in Baltimore a few years ago. And the person that you see is second from the left with the green shirt on is a prominent member of our Green Party, and he's out there leading the way of that march. So we need to both organize actions and show up for other people's actions and show that this is an issue that Green Party members are active on. We need to be pressuring our legislators. And if you're running for office, I encourage you to make this a real centerpiece of your platform. So our website's at the bottom, and then also our Twitter handle is there as well. But if you go to the Hope website, you'll find a news section that we update fairly regularly. You'll find the various tools pages. We have an action map, and we have action tools that people can use. And we really have this campaign to be in service to the movement. So if there are things that you need that aren't there, let us know, and we'll try to create those materials.